Hi, everybody. Thanks so much for joining us tonight. We have folks still kind of streaming in and getting settled, but we want to be respectful of your time. And we'll go ahead and get started. I am thrilled to introduce Doctors Boada, and I'm going to mispronounce it, but I'm going to try
Oh,
Wishern.
thank you. It's like my name is still my old name. I should change that.
Oops.
Uh,
well, hey everybody. We're going to be talking today about really practical tips on how to do well on your clinical rotations, which are really some of the most important pieces of your time in medical school. So I'm Christina. I'm an epilepsy fellow at Penn right now. And then hopefully we'll be shortly applying for jobs. And then Emily.
Awesome. My name's Emily. I am currently now a practicing orthopedic spine surgeon in Peoria, Illinois. I did my residency training in orthopedic surgery at Indiana University and then a spine fellowship at Cleveland Clinic. And I've been working with Elite Medical Prep since I was a fourth year medical student. So onwards of like 6 to 7 years now. Very excited to be here with you guys tonight. Please feel free to write questions that you guys may have in the chat or in the Q&A box, and we will try to answer those live as they're coming in, or at the end, we'll also save time for questions as well. So if there's specific things that you guys have that you are wanting to know about or thinking about in terms of your rotations, don't hesitate to ask. All right, so very briefly, just for those of you who maybe don't know about Elite Medical Prep, essentially Elite Medical Prep is a tutoring company built around tutoring to support medical school exams and performance on those exams. We have longstanding partnerships with medical schools around the world. We also offer one-on-one tutoring and a customized kind of educational program for students preparing for any of the USMLE exams and COMLEX exams, as well as the shelf exams for your third year clinical rotations. And we do residency advising, counseling as well, and then some MCAT tutoring too. So feel free to reach out. We'll have a link at the end too if you are interested in a kind of talking to somebody about what tutoring may look like for you if that's something you're interested in. Okay, so I think the first thing when we think about our third year clinical rotations and how to perform well and excel and honor those rotations is that the first thing is that you need to understand the system in which you're going to be graded. So, most medical schools still are using a grading scale for clinical rotations. For example, like in my medical school and in several others that I'm intimately familiar with, be like an honors, high pass, and pass type of a setup where you're going to be scored based on both your preceptor reviews and scores. And that's going to be, honestly, for lack of better words, sometimes a subjective evaluation of how you're performing at your level. And then usually there's also a component of your overall rotation grade that is going to have this shelf exam score. But both of those are going to be an important piece in the overall grade that you'll achieve for each of your rotations. And it's important that you kind of understand, if your rotations are pass fail, that's great because then, you just need to pass. But if you're being graded and you want to achieve a certain score or a certain kind of mark on your rotation, then you need to be aware of kind of how you're going to be graded. Um, I think on the next slide, we have a little bit more information on that too. So I think when it comes down to a preceptor review, like what does a preceptor want to see from you? How are you going to impress your preceptor? I know Christina has a couple of other pro tips on that later on, but I think essentially you want to think about it in terms of three main categories. Okay, so you have your patient interactions, and that's going to be how good are you at communicating with patients? What's your bedside manner like? And then how good are you at performing a history and physical exam? Are you able to ask the patient directed questions to obtain the necessary history to kind of arrive at a diagnosis and then also make an appropriate treatment plan for the patient? Are you able to perform a physical exam that yields, physical exam findings that also support that diagnosis or refute it? And then how are you kind of using that data to integrate into your final treatment plan and assessment of a patient? So that's kind of the first big category. Clinical reasoning and medical knowledge is kind of the other category, right? So that's like everything that we do in medical school up to this point in terms of your preparations for the USMLE exams. Are you able to come up with a differential diagnosis? Can you come up with one, two, three, maybe diagnoses that you're able to think about? Are you able to support your diagnosis with these like physical exam or history findings. For example, if you have a patient coming in with epigastric abdominal pain, and you're thinking that it's pancreatitis, or maybe you're thinking it's going to be, a cholecystitis. Are you able to support those diagnostic or differential diagnoses with your physical exam findings and history? They have epigastric pain, it radiates through the back, whatever. They have right upper quadrant pain. It's usually worse after eating, et cetera, so on and so forth. So understanding and having a good medical knowledge base where you can kind of bounce between differential diagnoses is going to be important. And then the other thing that people are looking for is just professionalism. So simple things go a long way. As a third year medical student, are you able to show up on time? That seems like a kind of a silly thing. We're all, been in school for a while now. You're in your 20s, late 20s, maybe mid 20s. You should be able to show up on time, but surprisingly, that can be challenging. Obviously, you're waking up super early, you're working longer hours. That can be hard. What are your interpersonal skills like? Are you able to call a consulting service and be polite on the phone? People are going to observe these types of encounters that you have. And that's what your preceptor is going to be looking at to try to score you relative to sometimes your peers, and then kind of establish your grade. Okay. And same thing with your interactions with nurses. That is a huge piece, I think, of excelling on your third year clinical rotations, is using the nurses and being nice to them and getting a lot of information from the nurses on your rotation. So here's an example rubric. Every rotation that you're on, your school probably has a standardized rubric. This is an example of what a rubric may look like for a medical student clinical rotation. And you can see that there's kind of these big categories: patient encounters, clinical reasoning. And then within those, there's kind of a scoring system where it's essentially 1 through 5, but they kind of delineate with very clear verbiage, what you need to do to achieve that kind of like 4 box score, right? So under patient encounter, you would achieve a score of 4 out of 5 if you're able to be precise, characterize patient concerns and new problems fitting into the clinical setting, and use multiple information sources. Whereas, if you look at 1 on the far left of the screen, you might not get a very good high score if you're inaccurate, often misses important patient information in the history, patient concern is poorly characterized. So that's kind of where understanding how to perform a good history and physical, where you're going to be evaluated for that. I think on the next slide, the rubric kind of continues, and you can see that the third category there is the professionalism. So, do you seek additional responsibility? Are you proactive in following up like tests or studies or anything that you're ordering on a patient? Are you requesting feedback? Those are going to get you a score for. So I think in general, this is not the rubric that your school necessarily uses. I'm sure there is something similar, but it's important to get a hold of this and look at it and read it so that you know how you're going to be scored. That will help you to succeed.
Thank you so much, Emily. We do have a couple questions in the chat that I'll go ahead and take the opportunity to address. So the first question was how to find clinical rotations, when to start, how many to do, and specifically in regards to international students. So I think in general, if you're an international student applying in the US, you're going to want to do clinical rotations in the US and obtain letters of recommendation from your clinical rotations in the US. Typically, if you have like a mentor or someone in your field at your institution that can help by reaching out to an institution that you're interested in the US, that's certainly one way to do it. Another way to do it is that you can apply to like funded positions, and a lot of the different they're called away rotations. Essentially, you will have applications that you can fill out. Some of the spots are funded. Some of the spots are specifically for students from underrepresented backgrounds. And so you can apply to those programs as well to try and gain entrance into the clinical rotations in the US. And how many to do really depends on your specialty and where you want to go and how geographically restricted you are, right? So like surgical subspecialties, and Emily can speak to this way more than me, we're going to require many more rotations than some sort of internal medicine rotation. But I think if you are really restricted, let's say, and you want to only come to New York, then it might make sense, even if you were doing internal medicine, to do, 3 internal medicine rotations in New York to increase your chances that you could secure a spot in that training program. All right. So in terms of, and feel free to keep putting questions in the chat, and we will answer them either as we go or at the end. So in terms of how to really impress your preceptors, I think Emily touched on a lot of this already, but basic professionalism is time and time again going to be helpful, right? Like at some point in your life, you're going to have a panel of patients and they show up at 8 a.m. to see you. And if you're there at 8:30, that's going to be bad for both them and you, right? So be early and be engaged, right? So you may not love every single thing you rotate through, but you gotta like put your best foot forward every time. Ask questions, and like the way I see it is for a lot of these specialties, it's like the last time in your life you'll ever really do them. Once you dive into your subspecialty, a lot of them are very narrow. And like your attendings might be consulting for things that like as a med student you may have known more about. So you want to take this opportunity to learn as much as possible, ask questions, bring up papers, whatever it is that you can find, and try and really like participate in the educational and clinical activities. Another thing that I think is really important is taking ownership of your patients. So, you like when you start out, they're going to assign you probably like one patient, and then hopefully by the end of your sub-I, you're carrying like 4 or 5 patients, something like that. And you really want to treat it like you're the attending on that patient. Like, what are you going to do? What are the next steps? Don't just think about like, what test am I going to order, but like, what am I going to do with the results of that test? Like, if that test is negative, what am I going to do? If that test is positive, what am I going to do? Right. So, really be putting together the plan for your patient in conjunction, obviously, like with the residents that you're working with. Because attendings will really take notice of that and it will look really good for you and honestly will help you practice autonomy that you will later have in your career. Um, and lastly, just be helpful. So, you know, being on like a busy medicine team or busy surgical team, like the residents are exhausted, they're working super, super hard. And if you can help them and like move clinical care forward, it's going to make a huge impact on the team. So I remember as a med student, I like did a lot of blood draws, I did a lot of ABGs. I ran labs to, here and there. I know other, med students who are doing a lot of dressing changes, things like that, right? So it's really like whatever you can do to be helpful, I think is going to be really important. And a lot of those skills, honestly, you will use, like being able to call a good consult is an essential skill you'll need in your residency pretty much no matter what field you go into. So starting practicing that early is really critical, and your preceptors will take notice. So additional things that you can do to really stand out. So really, this kind of goes back to taking ownership of your patients, but if your patient has a specific condition, read about it. So like let's say your patient has heart failure. Like what is the latest guideline directed treatment for heart failure? What are the treatments that have mortality benefit in heart failure? Does your patient actually need an implanted device because of some of their findings clinically? Can you bring that up on rounds? And actually, sometimes your team will be like, oh, actually, they do need that. And that's a good idea, right? So try and use each patient as a learning opportunity to like dive deeper into a topic that you're not as familiar with and like look at it as an opportunity to advance that patient's care. Something that's really important, something I see a lot or saw a lot when I was a resident was that sometimes, when you're presenting on rounds, it's really clear if you have not pre-organized that presentation and thought about what your assessment and your plan is going to be. And sometimes they're really challenging cases, right? And you're a learner and, maybe you don't know exactly what's going on with the patient or how best to organize it. So I strongly recommend, like, especially when you're starting out, touch base with the senior resident about the plan for the patient. Like, this is my interpretation. I think that they have Guillain-Barré and I think we should do an LP today, but like, what do you think, right? Because you don't want to kind of, if you can avoid putting yourself out on a limb or saying something that's not quite in the global picture of the patient, that would be great. And sometimes the residents will get a piece of information like 15 minutes before rounds that you do not get. That would really change the course. And so you want to talk to them and see if you can practice your presentations with them too, if they have the time. That way you can get feedback, make your presentation really nice. And by the time it gets to the attending, you're going to look really good. And you're going to learn skills from people who present like day in, day out, all day long. Um, Additionally, just be nice to everyone, and like that should go without saying, but you'd be surprised. And I think that like every hospital has a million different people, a web of staff kind of making everything work for patients. And so you really want to befriend everyone, right? Who's in the clinic? Who's the patient's bedside nurse, social worker, scrub tech, nurse, like all of these people have been around much longer than you in this like area, most likely, are going to know about your attendings, about the residents, and about like what is necessary and what the patients need. And so I think being really well integrated into your team beyond just the like physicians and other providers is important. And lastly, I think humility goes a long way in medicine and in life. And so, you'll be asked a lot of questions on rounds, and that's partially like an educational technique from the, residents, attendings, fellows. But be honest when you don't know something. Be honest also if you didn't do something, right? Because these are real patients and it's real people's lives. And so if like they asked you to go grab a lab or if they asked you to go talk to a patient about something and you didn't have the time to do that, or they asked you to check, the results of a test and you didn't, be honest about that because it is both the like ethically correct thing to do and also like people can experience adverse outcomes if you're not kind of forthright with that. And people will take notice as well. All right, studying. So the entire time that you're doing this and working so hard and reading papers and trying to take care of your patients and practicing your presentations, you're also going to be studying for a test. So at the end of each rotation, you take a shelf exam. Some medical schools will have extra or different tests, but it's usually a shelf. And these are like step two like questions. And you want to get through each subject while you're on the clinical rotation. So, like if you're on internal medicine, by the end of your internal medicine rotation, you should have done all the internal medicine questions. So, if there are 1,500 internal medicine questions, you can't start them the week of the test and expect to excel, right? So, what I did is that I would say, like, by the end of this week, I'm going to have done this many questions. And that way, if I was stuck in the hospital late one night, I'll just be like, okay, well, I'll do extra questions tomorrow to compensate for that. Or if I get out early one day, I'll do extra questions that day so that I can buy myself some time later in the week. And the other thing is that like there is downtime, right? Like you're kind of leading up, depending on the rotation, either you're in the OR, you're on rounds, but there's usually downtime somewhere. And so use that opportunity, the UWorld apps, you can get them on your phone. You can do questions on your phone, questions on your computer read, do cases in between, just kind of like try and fit things in so that you can be on schedule. Because your shelf exam, unfortunately, is going to be an important piece of your grade. And I think that it's something that in a lot of ways is a lot more objective than maybe the feedback that you get like when you're rotating through your specialties. Um, and you can use patients kind of like as inspiration, right, to delve deeper into something. Again, if you're like carrying a heart failure patient on medicine, kind of going through the bread and butter of that is really critical. But definitely start studying early. And you can make flashcards as well based on that information. You can study your flashcards while you're at work, walking to the bus, and these sorts of things. All right. So resources, I think in general, less is more. So you don't want to be reading 5 different books because you will read like 2% of each book and then collectively like not learn much at all, right? So you want to do a few things and do them well. So generally speaking, every rotation, and we have another slide on kind of like what books are good for what rotations, but most rotations will have a book that people tend to use anecdotally. And so you can get that book, talk to your, the other med students at your school, like what did you use as a resource? And then you have to do questions. Questions are the basis of like all medical school test preparation, which could be UWorld, AMBOSS, really whatever you like. And then, using flashcards because active learning is the most important part of memory consolidation and building a foundational knowledge. And if you just read something, that's very passive learning and that's not going to stick over time. So here are the resources that we generally use. I can say that I've used almost all of these when I was on rotations. So UWorld or AMBOSS, that's going to be your question bank. And so this is like really the foundation of your studying for your clinical rotation. So you're doing the UWorld questions for OB or the AMBOSS questions for OB. And that's going to be probably the most important resource that you have. And then the other resources are probably more rotation specific. Online MedEd has really nice videos. A lot of people like it. It's a good like reduction of big topics, I think, into like very digestible pieces. Um, and then for medicine, I think I used at least Step Up to Medicine, and a lot of people use this book. For OBGYN, there's APGO and there's also Blueprints, which is really helpful. I'm sure I'm sure people are still using Pastanas, which is a very small but very high yield book of like facts that are common on your surgery rotation. And then you also have your BRS books and BME practice tests, which are like kind of like shelf practice tests essentially. And then Anki is a resource that we are huge fans of here at Elite Medical Prep, where you create your own flashcards and then they basically bring back the incorrect flashcards sort of at the rate of difficulty that they were for you. So you have spaced repetition and it leads to better long-term consolidation of different facts. So in terms of shelf exams, in general, these are like going to be a subject specific small test that's very similar to your other sort of step test, but it's going to be more step 2E than step 1. It's going to be more like diagnosis and management type questions. And in general, like I would talk to the people who have rotated at your school, but the content is specific to the subject, right? But otherwise, the timing is the same. It's usually like a minute and a half per question. And the UWorld questions or your AMBOSS questions will really help you prepare for what you need to know. So for example, for something like family medicine, or internal medicine, it's really important to know the USPSTF guidelines, right? For screening for, lung cancer if you're a smoker and these sorts of things. Whereas in peds, really important to know the preventative vaccine schedule. And in neurology, you would really need to know some basic localization in the brachial plexus and in like the lumbosacral plexus. So each one kind of has its nuances, but they are going to be largely based on what you're coming across in your U world. And then the other thing is to talk to people who have taken the exam recently, and they can tell you any tips really or things that come up on the exam that maybe didn't come up in other spheres or come up clinically for you. And just remember that, some rotations are harder than others. So harder in terms of hours, but I cannot stress enough to start studying early. It's better to finish all the questions early and go back and do them later than not finish them and be not prepared for your shelf exam. Oops. All right. So practice exams are really important too. So usually these are just NBME practice exams. You can get them on the website. Often schools will have bought like a copy or two and they'll have a PDF that you can use and just take the PDF test and then grade it to give yourself like a rough percentage. And most schools will also have like a pass, cutoff for the NBME. So that way you can know like how much do I have to score? What percent do I have to get correct on my NBME to pass the exam? And a lot of schools will take the shelves really seriously. And if you don't pass, you're going to have to retake it. So it's really important to take that practice test ahead of time to know where you're at, take it early. That way, if it doesn't go well, you have some time to improve your score. So at least one or two is highly recommended. I think specifically like mid-rotation and then closer to test day, mid-rotation will just give you an opportunity to study more, right? And then you're only going to learn from your practice test if you study the correct answers and the ones you got wrong and try and figure out where you went wrong. So taking tests is really helpful to measure kind of where you are at in terms of content, but in order to learn from it, you do have to then subsequently review that test and then either make flashcards or small kind of highlight things that you need to go back and review more. And this is just our recommended kind of order of studying. And basically, the point of this very nice pyramid is that for learning, active learning is always better than passive learning. So that means asking a question and forcing your brain to retrieve that information is always going to be a more effective way to learn than looking at something and reading it. Because what happens when you look at something and read it is that you mistake familiarity for mastery. And you think that just because this sentence sounds familiar, like, oh, yeah, yeah, I remember that enzyme, you think that you know that thing. But then when you're put in a scenario where you have to retrieve that blindly, you're not able to. And the test is going to be a scenario where you're retrieving information that's not readily available to you. And so you want to be practicing that in your studying. And so that's why questions, like we said, AMBOSS or UWorld are the most foundational, most critical things you can do. And we really like flashcards for that reason too. Everything else is going to be supportive, but not foundational in your education. So whether it's like sketchy micro and you have nice visual aids or online med ed videos or you're reading, Step Up to Medicine, those things will help, but they should not be the foundation of your learning because they're not going to be robust enough to help you kind of encode all this information. Okay, I think a lot of questions came in while we were chatting. So let's see.
Yeah, I think the first question was from Geetha about looking for clinical rotations in New York City. So I think, Geetha, I'll kind of touch on this a little bit. I know that Stuart's going to get you connected, but I think the best resource as an international medical student looking for rotations is going to be to use the VSLO website or the Visiting Student Learning Opportunities website through like the double AMC in terms of finding a specific clinical rotation that you might be able to apply to do. So it's I don't know if you're familiar with the VSLO website or not, but I think that tends to be the best. I'll put the link to kind of that website in our chat today. But I think I would recommend that you kind of start there to find listed rotations that are it can certainly be a challenge, I think, to find sometimes clinical rotations, especially as an international medical grad. But I know plenty of people who have done it, and that there are rotations and they do exist, and most of them are listed on that website. So that's what I would recommend, or where I'd recommend that you start, and you can filter by opportunities, by like location for New York City specifically. And I think we had another question. Maybe you
Yeah.
can
Yeah, for sure.
take.
So this one says, if I want to get into internal medicine, do you suggest I look for internal medicine rotations or rotations to line up with pulmonary or cards? So I think if this question is specifically referring to like somebody who's international coming to the US to do a rotation, I think that, and honestly, I think also for somebody in the US, internal medicine, I would say, um, encompasses, right? Like pulmonary, cardiology, renal, all of those sorts of things. I think if you're coming from internationally, it would probably be better to do a more general medicine rotation just so that you have that sort of like foundational broad experience here. And then also so you can get letters of rec broadly in IM. However, I also think it's totally reasonable to do like a more subspecialized, like MICU, right, would still be very in line with internal medicine or pulmonary or cards, renal, all of those are still very like IME subspecialties. So I don't think that doing those would be harmful. I probably would recommend like a general internal medicine one, but if all you can find is like pulm or cards, I think that that's reasonable too. And they're all like housed under internal medicine. I just wouldn't do anything that is not under internal medicine. So like OB or something like that. Anything that's not like really a subspecialty or a fellowship out of IM, I wouldn't do if you are trying to go into IM.
Any other questions that you guys have specific to like how to call a consult, for example, or anything else that you've struggled with or seen on your clinical rotations that might be helpful that we can touch on or break down?
I see someone raised their hand. Feel free to type your question in the chat.
Okay, so
Um,
yeah,
yeah, go
I'll
ahead,
take that.
Emily.
I was gonna say, Geeta, we did mention that there are tests that happen during clinical rotations. I will say that as an international medical grad, oftentimes any rotation grades that you're receiving from a clinical rotation that you're doing in the US, you probably will not have a specific exam or test that's administered to you because your rotation would probably be classified under an elective or away rotation, audition type rotation. And so when we mentioned the test, that was probably a little bit unclear, and I apologize about that. But the tests are for the usually the U.S. medical students completing their third year clinical rotations, and they're kind of what are considered their standard clinical rotations, typically in like internal medicine, pediatrics, neurology, surgery, psychiatry, family medicine, etc. So typically, though, the rotations that you would do to kind of audition or try to get a position as a resident in the US, if you're coming as an international medical grad, you would not be administered any specific rotation tests.
And I think there's another question saying how and what tasks the doctor when asking them for rotation opportunities. So I think again, kind of going off again what Emily said, I like the vast majority of these rotations are going to go through VSLO, which is like the visiting students application for away rotations, or they're going to go through that university's own application system for away rotations. So, you can use connections to try and get kind of like more informal rotations, but most of the formal rotations are going to go through either VSLO or that school's formal application process. And so that means that you'll be probably submitting like your CV, your test scores, and then like a brief statement about why you want to do that away rotation. So you're not really going to be asking somebody like, oh, can I work with you so much as like you're going to be submitting your application probably to the individual who reviews it is often like the program director in that specialty. And then they'll decide kind of like what students they'll accept to the away rotation spots that they have, which are usually like a limited number. This one says, what type of rotation would have a better weight on my presentation? Something more surgical or something more clinical as an IMG? I guess the question is, what do you want to go into? I would
Right.
do a away rotation in whatever field you are hoping to match into. Um, that's the most important thing.
Yeah, because I think also on that note, like if you're trying to get letters of recommendation to support your application for residency, doing an away rotation and getting the support of somebody that you worked with will be really helpful in supporting your application, especially if that somebody you worked with in the US and you're hoping to secure a US residency position. And I think it's not really a matter of whether or not it looks better to do an internal medicine rotation or a surgery rotation. It's more a matter of who's going to write those letters of recommendation and what kind of exposure are you going to get to the program that you're hoping to apply to. Because I think a lot of times, you're putting your best foot forward when you do a rotation, and you kind of do well on that rotation. It's essentially like an extended interview. And especially as an international medical grad, you kind of, if you do a good job for 4 weeks, on a rotation in a specialty that you're interested in, a program at a program that you're interested in potentially matching at, then that will kind of help to establish you. And, then the people around you who are involved in the residency training program, they will recognize your name. They'll know who you are. They'll know that you did a good job on that rotation, so on and so forth. So I wouldn't recommend necessarily doing a surgery rotation if you're planning to apply for neurology, for example, or internal medicine. I would try to center your rotations as an IMG within the specialty of internal medicine if that's where you're kind of hoping to land. But within that, you definitely have flexibility to rotate on different services if you can find those rotations like gastroenterology, for example, or cardiology to the other points that people made before, or question you asked before. And so I think you can get letters of recommendation from any of those docs that you work with. So I would tailor your experience based on that.
There's another question here. There's two. One on does it make sense to do more inpatient or outpatient? And the other is how many clinical rotations. The clinical rotations like depends a bit on what field you're going into. And but I mean, I don't know, Emily, what do you think? Like for some like two or three?
Yeah, I mean, I think I have certainly known I've certainly known plenty of international medical grads that I've worked with who have done like five or six, honestly, clinical rotations in the US in an attempt to secure a US residency position. So, I don't think that there's a perfect number in general when we talk to, US medical students about doing away rotations or audition, extra clinical rotations to increase their chance of matching. Most people for, surgical subspecialties are going to do two or three separate rotations as a visiting student at another institution. But I think for an international medical grad, it's really, I mean, as many as you can conceivably do. Every rotation will kind of be another opportunity for you to see a different training program and for a different training program to see you. And like I said, it's kind of an extended interview. And so if you do well on those rotations, it definitely increases your chances of matching. And it definitely gives you extra opportunities to kind of connect with a physician or mentor on those rotations that may be able to write you a stronger letter of recommendation for your application. But obviously, there's time and cost involved with that. And so, I think whatever you can feasibly do, I think the more the better, generally speaking, unless you're going to get tired of traveling and then underperform because you're tired and cranky and you've been away from home for too long or you've, been on the road for a while. I remember sleeping on an air mattress for like 3 months straight when I was doing away rotations and I was a shell of myself. So, I think those are all considerations though when you're making a plan.
And I think in terms of the like inpatient or outpatient rotations, it depends on your specialty, but I would say in general, they're usually inpatient gives you like more opportunities, more time. Like it's typically you get to expose to more different types of people, and more like clinical teams, whereas like in the outpatient setting, you might only end up with like one attending or something like that. So you can do either, but I would probably err on the side of inpatient.
Yeah, agreed. Any other questions that you guys have? Feel free. We have until 8, so we're happy to answer any other questions to tailor this to what will help you all succeed. I don't, oh, I see what you wrote, Geetha. Are you talking about Indrajit's question about how and what to ask the doctor when asking them for rotation opportunities? I feel like, I thought you kind of touched on that, right?
We did, yeah.
Okay.
Basically, like what we were saying is that it's rare that you're going to be asking somebody to rotate directly. It's that you're going to be applying through an like a formal application process. So it's usually going to be like on the website of the school, or you're going to go through that like VSLO link that Emily sent. And you will click that and you will formally apply. And that will include like your CV, your step scores, maybe letters of recommendation, some statement on like why you want to do the away rotation at that school. So it's rare that you would be getting an away rotation just by asking somebody. It's going to be like almost certainly through a formal application process. Um,
Yeah, I think the only other thing I would say is if you're having, I think you said, Geetha, like it's hard to find or to get to meet the requirements of VSLO. And while I don't deny that that may be true, I think ultimately it will be very challenging for you to achieve match into a residency position in the US if we're struggling to meet the requirements for the VSLO, because in order to matriculate as a resident in the US, you do oftentimes have to kind of jump through those same hoops in terms of some of the credentialing and like approval process, institutional, like kind of grade verification and things like that that are necessary for VSLO. But that being said, you can certainly reach out to programs if you're able to log in and at least look at opportunities listed on VSLO. You can always attempt to send an email to the program coordinator or person who's kind of in charge of scheduling for any of the rotations. And usually that person is listed on most websites. So if you were to kind of search for like a visiting student away rotation in internal medicine or something like that, and you put in specific schools, for example, I think you said NYC, or you want to look me in New York, you could kind of Google and see what pops up and then potentially send emails directly to those schools and or to the person listed who's kind of in charge of coordinating the rotations, and reach out and say, hey, my name is so and so. I think the biggest thing when you're writing an email is to try to not make it overly lengthy, so that it's easy for the person who's receiving it to read it and act on it. But you also want to provide enough information to establish who you are and what your intention is and why you're reaching out. So I think, you would essentially say, my name is so and so. I'm currently a student at this university. I'm looking for opportunities to rotate in whatever, specialty it is. I'm particularly interested in being in New York City. Would you ever entertain like having an international medical grad do a rotation with your program? How can I go about setting that up or something to that effect, to try to kind of get your foot in the door? But you will probably have to send a number of emails, if I'm being honest. It's a lot of emails and kind of death by a thousand paper cuts sometimes in order to get somebody to respond. And you may have to kind of be persistent and try to send a couple of emails. If you don't hear anything back. And even so, they may direct you towards the VSLO website anyway, because they usually try to funnel a lot of the applications and requests for rotations through that website. So certainly possible that you could send an email, and have some success if you can't get into VSLO. But that's probably what I would recommend.
There's a question here about how to do clinical research. So I think definitely doing clinical research will increase your chance of matching into any specialty and also demonstrates interest in a specialty. And in general, I think the ways to go about it, there's kind of two pieces. First, like looking to people at your home institution. A lot of it depends on how much training do you have. Like, are you comfortable with doing basic statistics by yourself? Do you have a master's, PhD, something else? I think most folks don't, right? And their graduate degree is medicine. And so reaching out to people in the subspecialty that you're interested in at your institution and asking to meet with them to go over research opportunities. And so what I did when I was a med student is I would look up all of the faculty members in neurology and then specifically the ones in what I was interested in, which was epilepsy. And then I would look to see who had published papers that year. Because a lot of people who are in medicine are not publishing because, like, not all people want to be doing research, right? A lot of people are more clinically focused. They're interested in community engagement, they're interested in teaching, and so they might not be like researchers primarily. And so I would look to see, okay, who are people who are publishing and people who are active in research. And once I determined people who were active in research, then I would go through and look at their papers and see, like, okay, what types of things are interesting to me? Like, what of these papers would I be interested in reading? And then based on that, I would pick a few people to email and ask to meet with them. And before meeting with them, I would read what they had, like some of their papers, so I had an idea of what kind of work they did, and then just ask them about their work and if they had opportunities for me. And that's what I did, at my home institution. I will say that you can also try and get research at other institutions. Again, that will require like a lot of cold emailing and a lot of dead ends if you are like before you're ultimately able to get connected with somebody, if you are. But it is also worth a shot if there's a person at a specific institution doing something that you don't have access to. Sometimes it makes sense to reach out to them and email them too. So there's lots of different ways to do it. I'll tell you that like anecdotally, most people are going to send a lot of emails about research before, like as a med student, before you're going to get somebody who responds and has a project for you. So don't be discouraged.
I guess we have one last question from Diana about what kind of experience is better at the end to match. So yes, typically for international medical grads, you'll have two different kind of opportunities you may see. It's like a more hands-on away rotation, audition rotation type experience, or an observership. Some of what that boils down to is kind of your credentials that you're able to supply to the US institution that would allow you to be treated either as kind of a US medical student on your rotation with the ability to kind of engage in hands-on patient care, or potentially be limited to kind of observation only. And some of that again comes down to kind of what the credentials are that you're able to supply from your medical school background, and over what time frame to kind of get approved. I think in general, if you're able to do a hands-on rotation experience, that's going to be a more beneficial experience for you personally in your own education and training. And also just with respect to kind of impressing any sort of mentors or preceptors you're working with on that rotation, because they'll be able to get to see you engage with patients directly, and more individually, and be able to do a better job evaluating sort of your skill set. If you're just simply doing an observership, you're kind of just there to watch and follow around the preceptor. And so you probably won't be given the same sort of leash, so to speak, or the same responsibilities or ability to engage directly with patient care, which would limit kind of the scope of what you're doing during that month. Um, and so I think that would be my ultimate advice on that topic. But I know that those opportunities are oftentimes or can be challenging to secure. So
I saw one more question just on, and I guess this because we have 10 more minutes or
yeah.
okay. There's one more question about what kind of personalized tutoring do you give somebody who's getting a tutoring session with elite medical prep? So we offer a lot of different services. I think in terms of tutoring, we tutor for a lot of tests, but the most common ones I would say are step 1, step 2, and step 3. And these are US medical licensing exams that you have to take in order to match in the United States. And specifically, in order for you to apply to residency in the US, you have to have passed step 1, and then you have to have a step 2 score in order for them to kind of consider you. These tests can be really challenging, and so that is a lot of our work is helping people through this process. And typically what it involves first is a trial session where we go over your test taking history. What have you struggled with? What is your prior test taking like? And what does the future hold for you? How much time do you have to study? What resources do you have available? And then we typically will craft a study plan, go through what resources are required, how much time you should spend studying per day, like hour by hour and week by week and month by month. And then during the sessions, we typically will break down cases and concepts based on your areas of weakness. So for example, if you really struggle in cardiology, we may spend a whole 2 hours just going over basic concepts in cardiology. And we have our own like question bank and our own data sets that we use to kind of teach these concepts. We often will also do, question sessions together. So UWorld questions together, go over practice tests. It really is whatever the student needs and whatever we think would best support them. And then we guide them through that whole process.
Indra G has like another question. Does taking step three before the match help to secure a residency? I don't think it will hurt, is what I would say. So, whether or not it truly helps you, I don't know. I do think that again, when it comes down to matching people into residency, most US medical grads will take USMLE Step 3 during their first year of their residency, during their intern year. Now, that being said, if you're able to take it early and you do take it, I guess it kind of depends on whether or not you've already graduated medical school and if you're eligible to take the exam. Because I think you're not eligible to take USMLE Step 3 until technically after graduating from medical school. And so it will not necessarily help you in that event because if you haven't graduated yet and you probably cannot take the exam, then and you're applying to residency, then it's not really going to be feasible to take it. But if you've already graduated technically and fulfilled the requirements to be able to take USMLE Step 3, but you have not secured yourself a residency position, then I do think that taking Step 3, if you're able to, kind of shows that you're capable of passing Step 3 and that your medical, it's further like proof of your medical knowledge. And so maybe that does help to kind of encourage any sort of program that taking you into their program is not going to be a risk. You're going to be able to graduate, to take the exam, pass it, and graduate from a residency. So that I guess could be helpful, but it may be not feasible depending on where you're at in your training. Um,
I think so. The question about the study schedule, I mean, it's hard to say. That schedule is a schedule that I think a lot of people use because it is tried and true and has been effective for a lot of people. But really, what like we try and do is figure out what works. And anecdotally, some people that schedule will not work for them, and we'll have to come up with alternatives. So it really depends on like what your strengths are, what your weaknesses are, what your time constraints are. We work with a lot of people who are working clinically, right, in jobs, or they're working or they're in school and they can't study, 12 hours a day, 6 days a week. So it really depends on like what your specific circumstances are, what your study plan would look like, and also like how it goes, and like what you find that you're able to do and not able to do, because then we end up changing a lot of things. But I would say that like that plan that we put together on the website is a great resource. And I definitely like agree with everything that's on there. That's a really robust plan to get people prepared.
Thank you guys so much for tuning in, and I hope this was helpful. And best of luck to all of you guys in your endeavors. Feel free to reach out to Elite Medical Prep if you'd like to talk more or get paired with an advisor to talk about your specific situation in more detail.
Thank you so much. Bye.
Have a great night.